Hi there, thank you for joining us today. We're here in East Haven, Connecticut with our patient Chris. Chris had spinal surgery with us with Dr. Federico Girardi, one of the HSS spine surgeons, and he's going to be talking to you all about his active lifestyle, what brought him to HSS, and how he's been able to recover and is now pain-free. So Chris, thank you for having us in your home.
Well, it's great to be here.
Before we start talking about your story, can you just start telling us a little bit about your active lifestyle? You're into a bunch of different sports and recreational hobbies.
Well, great. Well, I live near the water, so I love water sports. Wakeboarding, love to be out in the ocean, love to swim, but I also am a winter sports guy, a big snowboarder, and really enjoy that. But in this kind of an area, we cycle, so I do a lot of cycling, but did mixed martial arts for 20 years. The last couple of years, I'm working on surfing, so if it's an adventure type sport, I'm kind of into trying it, and I stick with a lot.
And Chris has promised to give us a short demonstration later on, for those of you who want to keep watching for the next 20 or so minutes, some yoga moves to show off how well he's recovered from his surgery. So over the next, like I mentioned, 20 minutes or so, if you have any questions for Chris, comment below. And always remember to ask your physician first before starting or changing treatment. So Chris, you're into a lot of sports. You mentioned surfing, we mentioned the yoga, the mixed martial arts. So several years ago, when you first came up against a challenge and experienced some pain, tell us what happened. What was going through your mind?
Sure. So I have, for many years, had lower back trouble. I had a degenerated disc in L4, L5, so kind of the last disc in the spine. But what brought me to HSS was actually an injury a few bones up from that. I was doing mixed martial arts, actually training for a competition, and I was doing jiu-jitsu, which is a form of Japanese wrestling. And I had one of my classmates in a head triangle. His head was kind of like here, and we're on the mat. And I was pulling and pulling, and I felt something pop in my back. And the next thing I know, I am wailing around on the floor in pain. I've never really experienced pain like that. It was extreme. Kind of the whole class was kind of watching me do this. And about 10 minutes later, it was gone. And I felt like back to myself. It wasn't until a couple days later, I was actually driving about a mile from here, and my right leg just locked up. It was kind of a burning pain along the bone. I had never experienced pain quite like that. And I knew something was wrong. I knew it was related to the injury that I had a couple days earlier, and I immediately started talking to people and going to seek opinions about it. I work in the healthcare field, and so I was able to seek out some local surgeons to take a look and examine me and get their opinions on my case, and I just wasn't comfortable with what I was hearing. I was worried my future was over, quite honestly. What they were telling me and what they were recommending was basically saying, well, you'll be able to walk and go on long walks. And there's nothing wrong with long walks, but I'm used to cycling 100 miles. I'm used to falling off a surfboard. I'm used to going down the black trails out west in the big mountains. And to be told that I'm going to be walking was not something I was ready to accept.
And so you mentioned that when you had the pop and you're down on the floor and you're in obvious pain, and then a couple minutes later it kind of went away. When you went home that night, did you decide I still need to go see someone for this, or did you think that it was just something that comes and goes and I'll be fine?
Well, I'll tell you, in the martial arts, you have a lot of injuries. I've broken several ribs, I've torn ligaments. I mean, you're fighting, so you're going to get banged up. And so part of me immediately moved into denial, and I said, I'm going to be able to live with this. Even when I was being told by physicians here in the state that I had this injury, I was saying I could probably live with it, I'll work through it. But in the end, I wasn't able to work through it. It kept it persisted, the pain in my leg persisted, it actually got worse at times, but then my quad, which should be about twice the size of your calf, was actually becoming the size of my calf. And I knew something was wrong.
And so at that point in time, what's the thought process in terms of, do I stay local for care, or do I go to New York or another neighboring state for treatment? Well,
so it was interesting. I was here with my wife one day, and I had gone for 3 opinions here in the state of Connecticut, and I didn't like the suggestions for it just wasn't for me what they were offering, and they were Two were basically saying we'll do a laminectomy, which is basically a natural fusion of the spine, but it means that your mobility will be compromised. And I went back to the dojo, watching some friends train, you know, kind of missing it from the sidelines. Right. I wasn't in a position to train at that point. And one of my friend Charles says to me, he says, I heard what happened to you. You know, that's really serious nerve pain that you have going on there. He said, you need to go to the hospitals for special surgery in New York. You need to go to a place where they do a lot of this type of procedure on the spine, where they do procedures on the spine a lot. And so I took his advice. I reached out to HSS. I made an appointment. I went down. There were some things I had to do before. I had already had an MRI, but I went and had x-rays done, and all my my information was transferred down, and that's when I went to the spine center and met Dr. Girardi.
And had you heard of Hospital for Special Surgery prior to your friend's recommendation?
I had heard of it, and I mean, it's not hard not to hear about the #1 orthopedics hospital in the country, so I certainly knew of the reputation. I had known a lot of maybe half a dozen people who've been there for elbows or knees. I had not known anyone for spine. And, right. You know, again, when you start talking about the nervous system and the central nervous system, you think of, you're worried, right? You're like, this is a spine. You want to go to a place that, like Charles said, that does a lot of procedures on the spine. And so I had heard about the reputation, did a lot of Googling, a lot of studying of Dr. Girardi, and because I had the appointment with him that was coming up, and I went into it feeling relatively hopeful that there may be an answer there.
And no hesitation about traveling to New York?
None whatsoever. In fact, I would have traveled to California, and it's really just, it's a 2-hour car ride or a 2-hour plane ride to Chicago. I would have went wherever the care was, wherever I could be fixed.
So talk about the first impressions when you got to HSS, you meet Dr. Girardi, and also just compare and contrast sort of that experience to when you had seen some other local orthopedists.
You know, it's kind of like, for me, it's like when you go into a high-end clothing store versus just a local shop. From the time I was greeted at the Spine Center all the way through to meeting the different physician assistants and everyone along the path, I was treated very special. But then I met Dr. Girardi, and he took an inordinate amount of time with me. At least it felt like that. I felt like I was the center of his focus. We did a consult, my wife and I, with Dr. Girardi in his office. I had a physical exam. We came back in his office. He had reviewed all my films in advance. He kind of used that information along with the physical exam to then make recommendations. And I just felt like I was important to him. And at that point, when I left, actually my wife and I kind of looked at each other during the consult. We knew we were going there, just because it was such a contrast to what I had. And you have to be, you know, the spine, again, I was worried. And I wanted, I knew I would do something if I felt right, and when I was with him, I did. And so there was a confidence there that allowed me to move forward with what I was hopeful would be a fix for the situation I had.
And so prior to meeting with Dr. Girardi, what was your, obviously this is scary when something like this happens, especially when you're talking about your spine. What is your, emotionally, what's going through your mind? How scared are you to have a procedure? And then, you mentioned some of the confidence that Dr. Girardi instilled. Can you talk about a little bit that before and after?
I'll tell you, having had the L4, L5 pain over the years, you sort of learn to live with it. This was a different level of pain, and again, my leg was now starting to atrophy. Part of it's denial. You're saying, I'm going to live with this, no one's touching my spine, and then you get to a place where you move into that realm of hope. So I was depressed at times, quite honestly. I was not exercising at that time. I was feeling I was kind of hopeless about what the future held. And then, again, I got into HSS, met Dr. Girardi. There was this glimmer of, yeah, maybe I can get back to where I'm at. And so as fearful as I was about, having spine surgery, I knew that the course I was on was not acceptable. It would have been a half-life for me over the course of my life. And so I took that chance, but one that was in confidence, really. Right. I felt confident in what he was doing with me, how he was with me.
So Dr. Girardi, obviously, he shares with you, you need surgery, you're going to have to rehab. Generally speaking, is this something that he says, can take a couple months before you're pain-free, 6 months, a year? I'm sure, what were some of those questions I'm sure you asked, along those lines, that you were curious of before ultimately having the surgery?
Well, I work in the health field, particularly in the cancer field, so I had a lot of detailed questions about what if. complications, all these different things. And so we covered those, but also he was very clear it was going to be 6 months to a year. You would be back to where you were. And I just, that was like music to my ears to hear that.
Right.
That I would actually be back in the dojo competing, training to compete again. I could do whatever I want again. And, as a 43-year-old man, I mean, you still have your whole life ahead of you. And so we went into great detail, but my wife had as many questions that I
Sure.
did. And he took the time with Carol to kind of go through her questions, because she was living this with me. She was living with the results of that,
Right.
both the physical and the emotional.
Right, and so you have the surgery, and then the rehab process begins. And so, how often were you going to rehab? Can you talk a little bit in depth about what that entails? Are you going several times a week, several hours a day? For those of you tuning in who may be unaware of what that recovery process is like.
Mm. So during the damage that I had, and I had a ruptured disc, which is basically the explosion of the disc onto the spinal cord. I had a lot of fragments in the spinal tissue. And so Dr. Girardi had to pick those out, because if you don't take them out, they'll just move over time and create other tears. And so he did that, but that left some holes in the spine, which are a natural part of this type of surgery. And so it took me a little longer to actually move from the bed than was expected. So I got a little delayed start. Dr. Girardi kept reassuring me that things were going to be okay, and they ultimately were, which was great. But my rehab was then, I had the atrophy in the leg. I'm recovering from muscular spinal surgery in the back. And that was probably, we were doing it within the first month, like a couple of weeks out, 3 days a week. It was very gentle in the beginning, but the intensity was increased over
Sure.
time. Dr. Girardi had actually set the plan with the physical therapist as to what I was to do and how to advance it, which I felt, again, confident in, because I'm meeting this new person, but this is the person who's actually seen my spine tissue and knows what's going on inside. And so he consulted on that, followed up with me by phone to see how I was doing along the way, which was also quite reassuring, but really just plain nice to do. And so I had the rehab. I want to say it went for about 3 months. And again, a lot of it was strength building in the leg, and the intensity grew over time. And then I was back training, doing martial arts within 6 months.
So, do you remember that day like it was yesterday, when you were able to get back to those activities that you had always participated in?
I'll tell you, I remember walking after surgery for the first time. I remember doing stairs. As great as Dr. Girardi is, he's the face of a team. And so I just found the nursing staff to be exceptional when I was inpatient. I found the rehab team when I was doing rehab analysis in HSS to be fantastic. I remember walking stairs for the first time. You're like, when you're after surgery, you're learning how to walk. And again, the leg was pretty weak at that point. There was a kindness at HSS that I appreciated a lot. Sometimes, I was there for almost 7 days, and you wake up at 2 a.m. and there's a nurse that comes in and says hello.
Right.
There was a kindness, but there was also, you knew you were in the best. I knew I was in the best place, no doubt about it. And I knew I was going to get back to where I was. I had sort of, even with the dural tear, I had that confidence. And so over time, I was back where I was. But as I think back, there were moments when, like anyone, you're sort of on the road and you get, am I going to make it? Am I going to be at the next step? But there was always progression. And Dr. Girardi suggested, look back. Where were you 2 months ago? I looked back and I had significant improvement.
Right.
So I'm kind of a competitive guy. So for me, I wanted to be back in the dojo the week after.
Sure.
But ultimately, I knew there was a course and training I had to do for that.
So you've got the team at HSS that's helping you get through this, and I know friends and family were obviously integral in helping you get through the recovery process. What were some of their reactions to once you were doing better, and like you mentioned, back in the dojo?
I'll tell you, at first people were a little tender with me. They're sort of like, you're back in. They were, the guys I was training with were a little too gentle with me, but they picked it up after a while. And they saw that I was okay, and they could kick me just as hard as they did before. For me, I went snowboarding that following winter, and to be snowboarding out west on black trails, people I was with were like, "Are you sure you're going to go down those moguls?" And I was confident we were going to be good. I was out in Big Sky, Montana, just riding the bull. And at one point, I thanked Dr. Girardi in my mind, because it was like, he said I'd be back here. I'm back here, And it's been interesting. It's been 7 years since the surgery.
Right.
I didn't surf before the surgery. I surf not the best in the world, but I'm getting better every time. I did probably 50-mile bike events. I do hundreds now. So I'm still growing and in my physical fitness, but the surgery didn't, and the injury didn't stop me because of where I went.
Right, and we actually learned about your story from our Back in the Game patient forum, which for those of you who may not be aware, hss.edu/back in the game. We've got over 1,700 stories similar to Chris's, and when you found out about that forum, did you even have to think twice before sharing your story there?
No, in fact, I write partially professionally, so it was very easy to sort of compose my thoughts, and it was a way I could say thank you to Dr. Girardi and the team, because it really did mean a lot to me, and it was a way that I could share my story out with family and friends and say, you've known pieces of this, but this is why I'm in Montana right now.
Right.
Is because of this doctor and this team.
Now, before we get to a quick demonstration, can you share just a couple pieces of advice or inspiration for people tuning in who either might be going through similar circumstances to what you had gone through, or surgery might be upcoming and they're trying to decide, what do I do? Okay.
Well, for me, and I was right there. It's not a good feeling. Spine pain is really like nothing else, and so you're worried, you're frustrated. You're depressed at times, and that's all normal, but there are solutions. And so as much as you want to deny that and live with that pain, and I was kind of in that place at times, that there is a solution out there. And you go to a place like HSS and this particular team, in my case Dr. Girardi, you have a chance to return to where you were. And so for me, I'm an example of that, and ultimately, God willing, you'll be an example as well.
Great. So I'm going to move out of the way because we also want to demonstrate some of Chris's yoga moves now that he's pain-free, he's doing well, but we want to show you exactly just how well he's doing. So I'm going to step to the side for a second.
So when you do the martial arts, there's a lot of stretching, but also rehab is a lot of stretching as well. So after the surgery, I actually took up yoga. My wife and I do it 2 days a week. And so it's very calming and soothing, but it's also, there are things that just you would not be able to do if I didn't go to HSS. So this leg could not support me in this position. I would not be able to extend out this way and hold. There's just no way. The core strength that's needed here would not have been supported, and certainly my bones I would not be able to go back in this type of a position, move this way without HSS and Dr. Girardi.
Well, Chris, thank you again very much for having us in your home to share your story. And again, if anyone has any questions after you might view this video for Chris or for Dr. Girardi, feel free to comment below. So thanks again for tuning in. And if you have any other questions or want to check out more stories on Back in the Game, again, it's hss.edu/back in the game. Thank you very much.